When we're talking about must-have supplements to heal chronic fatigue, the first thing you need to understand is that you don't increase your energy by taking random supplements. I know there's a lot of hype around specific supplements, for example, vitamin D, vitamin C, or ashwagandha. But what these protocols often miss is that even though one nutrient can definitely be part of your recovery supplement stack, what you really should focus on is understanding the underlying causes of your lack of energy. I talk about this at length in a different video. There are many causes of chronic fatigue and they always work together. In this video, I will focus on the nutrient deficiencies and imbalances that add to your chronic fatigue. Because when we understand those, then we can design a supplement program that will help mitigate or overcome these nutritional imbalances. Together with your diet, the supplements will then make up your nutrition program, and we can use them for specific nutrient therapy. You will understand what that means in a second. Of course, testing is also always key. You never really want to work without the proper tests, but there are specific nutrient deficiencies / imbalances that we basically always see in chronic fatigue patients. I will now go over them and explain how to overcome them. That doesn't mean you shouldn't get tested, but around 80 to maybe 90% of people with chronic fatigue, especially the severe patients, will have one or more of the following. The first nutrient deficiency we need to talk about is a magnesium deficiency. Magnesium is one of the most important minerals in our diet, and it's a cofactor in over 300 enzymes. Because of that, it is often said to be the most important mineral in our diet. Examples where it acts as a cofactor include carbohydrate metabolism, muscle relaxation, and energy production. Understanding what role magnesium plays in energy production will also help you understand why a magnesium deficiency is so detrimental for your energy levels. As you probably already know, cells turn the food we eat into energy. Macronutrients like carbs, fats, and sometimes even protein are ultimately used to make ATP, adenosine triphosphate. ATP is the energy currency of the cell, and any good biochemistry textbook will tell you how it's synthesized in the mitochondria. What is often left out, though, is that ATP doesn't really function as a free molecule. It actually needs to bind to magnesium to become biologically active. So ATP should in fact always be viewed as a magnesium ATP complex. One of the key reasons for this is that magnesium stabilizes the negative charge of the triphosphate part in ATP. This makes the binding of ATP to enzymes easier. This also explains why a magnesium deficiency is so detrimental for your energy levels. Even if your ATP synthesis works fine, but your body lacks magnesium, it also lacks the ATP activation cofactor, so it can't really do anything with the ATP. A magnesium deficiency is super common among the normal population and basically always present in people with chronic fatigue. Now, to overcome the deficiency, obviously you don't just want to rely on supplements, you also want to consume high magnesium foods. But since this video is about supplements, you do also want to include a good magnesium supplement in your nutrient program. Restoring your magnesium levels can take a while. It's not done in a few days or even weeks. The reason for this is that you don't just want to restore magnesium in your soft tissue, but also in your bones where a lot of it is stored. I have a video on how to boost magnesium absorption quickly. It also goes over dosage and cofactors. I will link the video if you want to check it out. The next nutrient imbalance I want to talk about and that needs to be rectified to optimize your energy levels is tissue calcification. Calcium should be mainly found in your bones and teeth, with smaller amounts in the soft tissue like muscle cells. But in chronic fatigue patients, you often encounter something called tissue calcification. Here you have too much biounavailable calcium in places where it's not supposed to be. Biounavailable means that the body cannot use or eliminate this calcium, so over time it builds up more and more. This lowers the potential nutrient uptake of cells and tissue because calcium blocks the nutrient uptake, which then lowers the abilities of your organs to function properly and of your cells to produce energy. Calcium buildup in arteries can even be life-threatening because it stiffens the arteries. Another problem with biounavailable calcium is not just that you have too much of it in places where it's not supposed to be, but also that you have too little of it in places where it's supposed to be. So a calcium excess in the soft tissue can often come with a calcium deficiency in the bones, teeth, and sometimes blood. This makes it very confusing, and a lot of people that are diagnosed with a calcium deficiency because of a blood test actually have a calcium bioavailability problem. Reversing tissue calcification is one of the main goals of any properly designed nutrient program. Key players are again magnesium, vitamin K2, sodium and potassium, which are mainly governed by your adrenal glands, and sometimes other cofactors like boron. Whether or not you also need to take calcium supplements if you have a deficiency in the blood has to be decided on a case-by-case basis. There are many practitioners nowadays that really vilify calcium supplements, but I believe that when it's given to the right person at the right time, it can definitely be helpful. Copper toxicity is the third nutrient imbalance that is basically always present in people with energy problems. This is similar to tissue calcification, but this time it's a copper problem. So again, you have a buildup of biounavailable copper in places where it's not supposed to be, at least not in these high amounts. For example, your liver, brain, or muscles. And it also often comes with a copper deficiency in the blood or places where it is supposed to be. The result are all kinds of nasty symptoms. For example, hormonal problems, anxiety, sympathetic dominance, and of course, chronic fatigue. This is because bioavailable copper is needed for cellular respiration within the mitochondria, so the energy production inside the cell. Also, an excess of biounavailable copper in the nervous system and brain leads to the conversion of dopamine to adrenaline, which means you're adrenaline dominant and have a high likelihood of burning out. Now, how do you fix copper toxicity? I would say of the nutrient imbalances we talked about so far, so magnesium deficiency, tissue calcification, and copper toxicity is the most difficult to treat. There are many protocols online, but many of them aren't that great. This should be done with a trained practitioner who knows what they're doing. Well, the reason is that mobilizing copper, so bringing it out of storage and eliminating it through the liver, can be an unpleasant experience if you aren't prepared. I have a step-by-step guide in my recovery program, along with a list of recommended practitioners that can help you along the way. Your protocol will include key players, for example, copper chelators like vitamin C, sulfur, and molybdenum, and also copper antagonists like zinc or manganese. But please don't go out and take them blindly. There are other things to keep in mind, such as your ceruloplasmin levels, liver health, and also nutrients that are depleted by copper detox and that need to be replenished. Again, copper elimination should be done carefully. The secret really is to go slow and mobilize your copper gradually. Okay, those were the three most common nutrient imbalances that we see in people with chronic fatigue. And usually the more severe the chronic fatigue, the more severe these imbalances/deficiencies. Now, to wrap up this video, I also want to talk about general nutrient deficiencies that will lead to less than ideal energy production. They're not necessarily related to a specific condition, but will add to your fatigue if they're not replenished. So for example, a deficiency in B vitamins will hurt your digestion and energy production because they're necessary for the conversion of carbs, fats, and proteins into usable energy in the form of ATP. We also need to look at your thyroid and adrenal glands because they're the two most important organs for your metabolism. Your thyroid needs iodine and selenium, and your adrenals need nutrients like vitamin C, sodium, and potassium. Great. Now that you have a long list of potential nutrients that you might be deficient in, what should you do if you're affected? What should you do if you suffer from chronic fatigue? So first, please familiarize yourself with the conditions I explained in this video. They're basically always present in chronic fatigue, and I explain them in much more detail in different videos. This is really key to understanding the causes of your chronic fatigue, at least from a nutritional point of view. Then I would advise you to get your nutrient levels tested correctly and seek out a protocol or practitioner that can show you how to optimize your nutrient levels. Obviously, I would recommend my own program, which includes the best practitioners for this in the world, at least in my opinion. It's what I've used to recover and explains everything step by step. not just the nutrition side, but also other factors involved, like detoxification and nervous system imbalances linked to chronic fatigue. I wish you all the best and hope to see you in the next video.